If you have partial ACL injury, then that is a big question whether surgery is required or not. Now ACL is composed of two bundles. One is at the front and on the inner side of the knee, and second is at the back and outer part of the knee. So whenever there is a partial ACL injury, that might represent injury to one bundle or an injury which is partially in both the bundles. So normally when there is a partial ACL injury, you don't come to know by report how much is the injury. It might be 5%, it might be 10%, 15%, 20%, or even 90%. We don't know how many fibers are broken. So if there is a partial ACL injury, sometimes in report it is mentioned as subtotal injury or near total injury or near complete tear. So that makes the nomenclature very confusing and people are not able to understand whether this injury is significant or not. Now, if you are 25 years old and you have a subtotal injury, which is showing that more than 50% of your fibers are damaged, and you have an instability while running or walking fast or coming down the stairs or while you are trying to rotate your knee, then that might need surgery. But if you are 45 years old and injury is not very significant on MRI, but it is still a partial ACL injury, and you don't find any instability while coming down the stairs or rotating your knee or while walking fast or running, then you might not require surgery. So if there is a partial ACL injury, see your doctor. First of all, your doctor will look at your MRI film, and he will see whether it is a complete injury or a partial injury, and if it is a partial injury, how many fibers are broken. If it is more than 50%, then normally it is a significant injury. And then we correlate it clinically with patient symptom. If the patient is complaining of instability, or if the patient is young and wants to get engaged in these sports later on, say you want to play football, and there is a subtotal injury to ACL and there is an instability in the knee as well, then it is better to go for surgery. Surgically, we do arthroscopic augmentation of this broken ligament, which almost gives complete pain relief as well as instability relief to the patient, and patient can get back to normal activities. So if there is a partial ACL injury in your MRI report, see a physician who will look at your MRI. He will correlate your symptoms clinically with the three symptoms or with the three signs that I have just mentioned. And then you can decide whether for this partial injury you require a surgery or you don't require a surgery. If surgery is not required, then we give injection filled with regenerative molecules in the knee. We ask the patient to do strengthening exercises, lose some weight. And in majority of the cases, we are able to treat partial ACL injury without any surgery. Thank you.